some time, the wage bill in Siaya used to be below 35%. When I look at the numbers here, you appear to have gone to close to 40%. Where are you? Because there are few issues here of HR, which the auditor is going to report on in the next audit. Things like compensation of employees, excess and unsupported payment of allowances, etc., etc. Those are things that add up to your wage bill. Why is your wage bill growing? And yet, with your revenue growing, that percentage should be remaining constant or reducing.
I've always held the argument that there are certain sectors, if you make them part of the wage bill, then you end up denying services. Like one of the areas where we were forced to recruit quite a number of people was in the health sector. You know, doctors, we had, in fact, the other day we were here before the Ososi committee, where the observation was that we did not have certain personnel in various medical institutions that were supposed to have a certain number of nurses, for example. So in order to reach that level of employment of skilled staff, particularly in the medical profession, we have had to employ doctors, employ nurses, clinicians, so that in the 11 or so hospitals that we have, we would have doctors, clinicians, dentists in the service. The other area is where Siaya is doing very well, ECD teachers. It is just last year that we decided to put them on permanent and pensionable terms, all our ECD teachers. And that, you know, made the wage level go up. And I could go on and on, but imagine constructing these ECD centers, and you have volunteers, some of them unqualified, to take care of kids. If they're not taken care of at that young age, their life will never really be the same, because that initial contact with their trainers at these ECD institutions are very critical. So actually we can demonstrate where we had to recruit a number of staff. But I believe in the next financial year, we may do a little bit better than we have done in reduction of the wage bill. The other sector is also the agricultural extension officers, and in the blue economy, we have had to recruit quite a number of staff in those sectors.
Yeah, those could be the global causes, but the Auditor General has pointed out at specific cases where compensation of employees was not done in line with the law. And we have asked the Auditor General to reflect on the recommendations of the County Assembly and give us a more comprehensive report. The National Treasury, maybe that conversation that the Governor is alluding to needs to be had, because when fuel is used, when you fuel an excavator to do a road, that fuel is capitalized, isn't it? But when you fuel a car to go to a meeting, that fuel is part of operations. So in terms of classification, I don't know whether it's something that is in the works to take into account what the Governor is saying. When you pay a doctor to deliver health service, which is a function of the county government, how do you then classify that? I think there's been an argument that that then ought to be capitalized as development. It's contrary to accounting principles, but maybe there needs to be a way of looking at the component of staff, and then we check out which percentage are doctors, which percentage are engineers, And which percentage are those that we call sangueñas? Because you might hide behind doctors and nurses, and yet you've got a staff establishment full of ghost workers who are delivering nothing of value. So, Auditor, could you also try to test that?
Indeed, when we are doing projects, the labor that goes into that project is supposed to be capitalized. But when we are paying other expenditure like drivers for chauffeuring you, that's a recurrent expenditure and it's considered an expense. So, but sometimes the line between the two becomes very thin, because I've heard that there is a teacher who was asking me, a university lecturer who was asking me, when we do research, why should that be used as a recurrent expenditure? We are guided by accounting standards, and they will tell us when to capitalize and when to expense. Although sometimes there is a lot of judgment in that. But as he has said, we are going to explore and see what can be taken to development and what can be taken to expenditure, because actually I would treat health as a development expenditure. Thank you.
But this kind of breakdown analysis, if you have a county public service board that is functional, then it's also possible to get a breakdown that, fine, we have put it as recurrent, but we are able to tell that the productive workers are taking this percentage and the rest, the joyriders, are taking this percentage. Isn't that possible to break down, OAG, if you demand from the county secretary and the public service board?
Well, sometimes it's difficult to do that share unless you are looking at a manufacturing entity. When it comes to hospitals, even a nurse who works in an anesthesia is equally as important as the doctor. So there is a very thin line between that development and recurrent expenditure. But going forward, what I'm saying is that I will consult even ISPAC to see what they have to say about it.
Okay.
But we also have access to our international bodies. We can also see how they treat.
Yeah, let's see how to bring that clarity. Governor?
Yes.
Chairman, I think it's also important to look at the full picture. If you look at what we are putting in development, Siaya now we are at about 37%, and we are trying to get to 40%. So we are suppressing some operations which we think are not critical, in order not to compromise, investment into development projects and sustaining the ones that we have built. And there's another issue, if you allow me to comment, which has brought some bit of controversy. This health workers, if they were to be recruited by the county public service board, then they have been recruited in accordance with the laws of Kenya, which commonly we are moving away from having casual workers, because literally those are contracts of enslavement. Now, these health workers are paid stipends by counties. If they were to be recruited as workers, then our wage bill will shoot up, because then you have to pay them living wages instead of paying them a stipend. And what they're paid is not a salary, it's a stipend. And I hate that in our counties we are paying people 3,000 shillings and hoping to sustain them as health workers. It can't really work. But it cannot be the subject of recruitment by the County Public Service Board, because County Public Service Board can only recruit people who are engaged in terms of the Employment Act, and not on the basis of the kind of stipend to pay the health workers.
Yeah, that's also another matter that the Council of Governors and national government are yet to agree on. The Governor Muthomi Njuki was here. He's a chair of the Health Committee, and I think there were some conversations with respect to that. I'm not sure whether you have resolved the impasse on particularly on okay, there's UHC and then there's the community health practitioners. On UHC workers, have you absorbed your share of employees?
I think the matter is still not fully resolved because UHC workers were actually engaged by national government. And you find most county governments will not be able to foot the bills for UHC workers. But as regards the question of resolution of the debate around health workers, you know, there was a period where we were in competition, where national government was paying part of the stipend directly, and the county governments were paying the stipend also. I think the decision should be made is whether they should remain in the domain of the counties and resources be channeled to the counties, and the national government would have nothing to do with the health promoters and should be left, and then if it is left to the counties, resources should then follow functions.
Though, Governor, to be fair to the Senate has already approved an additional allocations bill or act that has transferred the CHP component to the counties. In terms of the salaries, the national government portion should come to the counties so that the counties do the payment. But we still hear the national government paying directly.
They're still being paid directly by the national government.
So what should be done? Because that's a violation of an act of parliament. An additional allocation bill should transfer the resources to you to do a defined function. Why should they pay directly? And I say this because in one of the mediation sessions that we had with the National Assembly on that bill, some members of the National Assembly were asking, what is the worst that can happen if we don't pass this bill? In their mind, they felt that the national government can still continue doing those things directly. Whether they are industrial parks, they can pay the contractors directly. They can pay the CHPs directly. They can pay flocker things directly. They can pay contractors on KISIP directly. That is the thinking in the National Assembly. And I think that could be the thinking also in the National Executive.
A lot of these things, if Parliament does not act as a body, then the good intentions of the Senate will negate it all the time. At least we have seen what the Senate is doing in protecting counties. But it is not an obligation only on the part of the Senate. It's an obligation to the National Assembly and to the Executive. I'm not afraid to say that the intransigence in the National Assembly is being encouraged by the national government. If they were clear on this matter, I don't think these problems would arise.